Hello, I'm Dr. Meg McGrath from Boston Medical Center, and it's an honor for me to present at the SAEM Virtual Conference, May 2020. The title of our project is Invisible Wounds, Adverse Posttraumatic Neuropsychiatric Sequelae Among Patients. I have no personal disclosures to report. The study that I'll be speaking of, the Aurora Project, is funded by the NIMH, the U.S. Army Medical Research and Material Command, the One Mind Foundation, the Mayday Fund. Verily, Life Sciences and Mindstrong Health both provided hardware and software for study assessment. About a third of emergency room visits are for an evaluation after trauma. These patients are seen, maybe receive an X-ray or other types of wound care, and are discharged home. We believe patients think they have no serious injuries because they're seen, treated, and sent out. There's very little attention that's been paid to the possibility of adverse post-traumatic neuropsychiatric symptoms for this group. The Aurora study was designed and is coordinated out of the University of North Carolina. Dr. Sam McLean is the principal investigator. This is a large longitudinal observational study enrolling patients at 29 emergency departments throughout the United States. Here's a list of the enrolling emergency rooms, and you can see that it represents a very diverse group of hospitals, again, in every corner of the United States. Subjects are enrolled who are over age 18, who speak English and are non-pregnant. This is during the immediate aftermath of trauma, so within 72 hours of a traumatic injury. They're approached by trained research assistants who screen them for eligibility and then obtain informed consent. Patients need to have access to a smartphone and be willing to give blood and DNA, as well as be fitted for wearable wrist technology that can track their heart rate, sleep, and other parameters over time. They also participate in phone surveys, and a subset of patients have an fMRI at follow-up. We were interested for this project in the outcomes at 2 and 8 weeks after enrollment. We wanted to learn how many patients were still experiencing moderate or severe acute neuropsychiatric symptoms, such as depressive symptoms, post-traumatic stress, somatic symptoms, and pain. We analyzed 1,618 cases, 64% were female, 67% non-white. This was a young cohort with a mean age of 35 years. About 78% had experienced a motor vehicle collision, 10% experienced physical assault, and the rest experienced other types of traumatic injuries. And again, most were discharged home after evaluation in the emergency room. We found that at 2 weeks, 88% were experiencing more than one moderate or severe neuropsychiatric symptom, and that 72% experienced more than 2 of these symptoms. This persisted out to 8 weeks, where 81% were still reporting at least one moderate or severe type of symptom, with 62% reporting more than 2. To be a little more specific, at 2 weeks, 79% were experiencing moderate or severe pain, 72% had somatic complaints, 53% had post-traumatic stress, and 30% were reporting depressive symptoms. Out at 8 weeks, again, 65% were still experiencing moderate or severe pain, 66% reporting somatic complaints, 49% reporting post-traumatic stress, and 27% were reporting depressive symptoms. We found that these acute neuropsychiatric symptoms were very common after trauma, even out to 8 weeks. In terms of future directions, we are eager to learn more about the biologic, genetic, and behavioral factors that may contribute to making a patient more at risk for experiencing these longer-term neuropsychiatric symptoms. Our ultimate goal is to develop screening and treatment protocols that we can use in the index visit in the emergency room to help find and treat these patients appropriately. And now that we're in the COVID-19 pandemic response phase, we're considering how this baseline degree of acute neuropsychiatric symptoms may fit in with what patients are experiencing now. I'd like to thank the many site investigators who've helped with enrolling patients at every site, many of whom are authors on this abstract, as well as are working now on the manuscript to follow. Thank you for your attention.